So my name is Candace. I am a nurse practitioner here at Nepenthe Wellness, and I would be thrilled to meet you and help you on your journey to better mental health. So my qualifications are that I'm a family nurse practitioner and I graduated from University of Texas at Austin, and I have been working primarily in sleep medicine prior to coming to ketamine treatment. And so in sleep medicine, we do see a lot of patients that have depression, anxiety, and so I'm very familiar with that symptom profile. My role at Nepenthe Wellness is, as a nurse practitioner, I will go ahead and do the assessments on the patients when they're coming in as a brand new patient. I do the physical exam, and then I also get to start the IVs on our patients and monitor their health all during their treatment, because we do keep eyes on them the entire time. We're monitoring their vital signs in real time, heart rate, blood pressure, oxygen saturations, all to make sure that everybody's perfectly safe in our hands. This job has been so wonderful because you actually get to see patients when they're coming in and they're struggling with the depression or anxiety, and then over the course of treating them, you get to see that change in their disposition, in their emotions, and you get to see them, they look genuinely excited to come in and see you. And most people aren't that excited about getting injections or needles, but to see that change in them and to also talk to the family members that come in and drive them home, and to know that you're making an impact in them real time as they get treated. Ketamine treatment has been a big change in how we treat depression and anxiety, because it's a totally different mechanism of action. And so what it does is it enables the person to get a little bit more distance from their depression, anxiety. A lot of these patients have been dealing with depression for years, and they feel like it's an ingrained part of them. Like they identify that, yes, I'm just a depressed person. And what ketamine treatment enables is them to get a little bit of distance and to see that that is not all that they are, that there is somebody that has been buried underneath all that depression, anxiety. As I mentioned, it is a totally different mechanism of action, and so most of the medications that are out there right now are selective serotonin reuptake inhibitors or norepinephrine reuptake inhibitors, and those are affecting those two neurotransmitters. How ketamine works is it actually affects your NMDA receptor, and it binds to that receptor, and when that happens, your brain releases more glutamate, and that is the key neurotransmitter in neuroplasticity or neurogenesis. So it's actually a key component in forming new neural pathways. And so a lot of people with depression, you kind of get involved in that same thought process, that same well-worn path, and ketamine enables you to forge new pathways in your brain to help all of that change and to cement those changes. Everybody's experience is different, and it even changes for the same person, even at the exact same dose. So when we tell you what it's like, it's the generalities. Typically most people will feel like a floating sensation or feel a little bit more disconnected from their body. Some people might experience hallucinations or visual or auditory changes, but typically it's very safe, it's very calming. We do have great videos for you to watch that are usually nature-based, along with music. Music is very important in the ketamine experience, and so it's very soothing music without words, so there's nothing to trigger you or create any unpleasant thoughts. Ketamine therapy, if you're doing it under the eyes of a medical professional, is no long-term health risks that we're aware of currently, but there are long-term health risks if you are doing ketamine recreationally. So that's where I would tell you, it's like any drug, the more you do, the more issues there would be later on down the road. I think ketamine is revolutionary in how we treat depression and anxiety, as well as chronic pain, PTSD, and I wish more people would consider it, but of course this is not the first line treatment for any of those conditions, but it is a amazing change that you can see in patients that have struggled with this for a long period of time and feel like nothing is helping. Ketamine treatment, I would say give it a shot before you go on to other ideas like ECT. I know of one particular patient that I saw from the beginning to the end, and this patient was very depressed and very unhappy when they came in and wasn't really sure that they were going to see any benefits with ketamine. And I got to see him after the first couple of IV infusions. He was still like, well, I haven't really noticed anything, big. But then after those first couple, you could start to see the change in him as he was coming in. And when he left, he was, wanting to give everybody hugs. He was definitely, you could see it. His whole demeanor had changed. Normal IV ketamine infusion treatments, it is a series of 6 infusions given over about 3 weeks, because that's how most of the studies were done that evaluated its efficacy. And so that's what we recommend for most patients. But some patients don't have that breakthrough or that, aha moment in those 6 infusions. So for those patients, we do have an extended protocol, which would involve 3 more infusions. Because if you're on that precipice, we don't, want to say, okay, you're done. So we do have that option for you if you feel like you're just so close. Nepenthe Wellness, that's how I initially came in. Was I had a family member who was a patient, and I was so impressed with the environment. It felt like one of my favorite spas, where everybody was very welcoming. It was a very home-like, relaxing environment. And I could see where people would feel more at ease and more comfortable, with ketamine, which is a psychedelic experience, in this environment, because it is so controlled, it's so comfortable.